through this, but you can see this is a really nice result so far just after a single combination session. I'm going to go through this process in detail in just a few moments, but it's nice just to be able to see this journey right now already for this patient. He has a little bit of redness, no big deal, 1 month out. I normally don't show this typically for the feed when we put this on social media or on a website because it's really early, but you could already see there's really great tissue contraction. The tissue quality is a lot better. We have significant improvement of the scars already. So I wanted to showcase that for you. The collagen response hasn't even happened yet, and we already see great results here just 1 month out. And a lot of that's due to what we did, which was Subcision, and then we also did some Bellafill at that same day. And then we did some TCA cross, and we also used a laser for this patient. So we did a few different things. What you mostly see right now are the results really of that Subcision, the Bellafill, and then the laser to smooth down the scars. Now, of course, when this patient came in, we still expect to do more treatments for him. So that's what we ended up doing. But already we can see really, really beautiful progress here. So this is, 1 month out, early result. Just want to showcase that for you guys. And what I'm going to do here for people who are just joining on, I'll kind of wait for more people to come on. And as we're waiting, we will kind of go through some questions as you see them, and we could talk really about anything related to acne and scars, pigmentation. We could do all those different things because that's what I mostly focus on in my practice. And I do a lot with collagen production as well. I also do a lot with skin tightening. So, I'm over in Newport Beach, California. Mostly what I showcase on here is for acne, but I'm happy to go through other processes. Also, we do a lot with also filler and also even dissolving filler. I dissolve a lot of filler every single day. I dissolve filler from this whole area in Orange County. And even I have patients fly into me because I'm one of the few practices across the country. I've been using ultrasound to dissolve filler for years and years. So something that I think a lot of people really appreciate is that we could go directly inside the actual lesion, actual hyaluronic acid portion, and go right at the source and dissolve filler. So something that I think really should be talked a little bit more about too at some point. So I'll go through that one of these days too. But for now, I wanted to showcase this. This is that process right now for scars. Just again, this is a single combination session right here for this patient. He's somebody, as we go through, and we'll wait for more people to come on. So I'll go through the whole process of how I did these scars. And part of the reason why I think that you could already see really nice results at this point. Let's see here. Thoughts on Opus for acne scars. Can't afford anything else. It's a good question. I was looking at it. It's not something that I use in my practice, but I was open to it because it was something that, if it does work, it's nice because supposedly there's less downtime. That being said, I haven't seen really, anybody showcasing great results or anything like that. So I'm not entirely sure if we're really seeing that with Opus. Like, I'm not sure if you really see too many patients with results. But if you happen to see those, let me know. So I will go through a little bit with, as we're getting more people on, I'll go through the case. I know there's a bunch of questions going through, so I'll try to hit those up as I see them. Does Accutane and Derma Roller deal with scars effectively? Accutane does help somewhat with scars, but not really enough, really. Accutane does help, but it's not really going to solve most scars, though, really, to be honest with you. It's going to give you a little bit of collagen production, which is useful, of course, but actually solving the scars really does require manual work a lot of times, doing Subcision, doing TCA cross, doing things like Bellafill. Those are things that are going to help. These results are going to continue to get better just by itself, by the way, especially if we continue to have the oil production under control. He doesn't have acne. We're going to continue to see his progress over time, and it's going to be really, really nice to be able to see that. Let me know when you're hiring at your clinic. I work at a med spa. What do you work at over there? Coco saying, can you treat your scars with active breakouts? Typically not, honestly. That's one of the big things, the big factors really in terms of getting really excellent results for some patients is that the oil is under control, their acne is under control before we do the scar treatments. Now, have there been some cases where we still get great results even when there's some acne? Yes. But we want to do everything we can to maximize results. And so one of the big things we want to push is less oil production. And then we, of course, also want to make sure there's no active acne as much as we can possibly do. We want to control that. Benjamin's asking, time is going to be the best method. Okay, let's see. Time is going to be the best method for acne scars. Not necessarily, actually. Time could actually make scars a little bit worse if you don't do anything, because as you get a little bit older, you're going to lose those fat pockets in your face. And essentially, as you lose those fat pockets, now imagine you're going to get some depression there. And that depression now could cause the scars to be a little bit more visible. Let's see, Coco saying, what do you suggest for clearing acne before treating the scars? So there's a few options, really. It depends on how severe the scars are. We have to do something typically, especially if there's oil production. So things we may want to do is like we could do oral spironolactone for hormonal reasons why you have acne. Other things we may potentially recommend, either the Cure laser, which is similar to Accutane, or Accutane. Those are all options there. So a Cure, which is basically targeting the oil glands directly at its source, normalizing the oil production. Or we may recommend for some patients, if they want to, Accutane. That may delay treatment a little bit more. There's more of systemic side effects, but we have to do something really to control the oil production. And so those are kind of what we would recommend. Now, if there's more like just if it's more of bacteria that we just have to control too, then a lot of times what we do is we do topical antimicrobials like Dapsone, topical clindamycin. Those are all good options. Or sometimes we do oral doxycycline. Let's see here. Okay, saying, how long is the minimum time when scars form to treatment? I guess I'm missing the question. Are you saying that if you have acne, how long does it take for scars to form? Is that what the question is? Because it could happen right away. Stephanie's saying, what if the source of acne is tretinoin? So basically she's saying that you purge afterwards. And so sometimes what happens is that you overly dried your skin and then you get a rebound of excess oil production afterwards. And then what ends up happening is that can end up causing you to get breakouts. So the things that you could do, basically, you could actually take Claritin. Claritin actually helps prevent the purge with tretinoin. That could actually be a really good idea. You could also actually consider doing something like zinc. Actually, zinc could actually help as well. But I usually recommend mixing it with a little bit of a moisturizer first. Do that for a few weeks, and then slowly you could taper off the moisturizer. I'm streaming on multiple different platforms, so I'm going to try to hit all the questions that I see. I know I'm getting them from multiple different sources over here. A lot on certain platforms. They don't want me to mention each platform while I'm on here. But I will say though that I will get to your questions though. So feel free to repeat it if you feel like I missed it though, just so you know, because sometimes there's a lot of questions that are coming through on multiple different platforms as I'm seeing them. And, I'm also on YouTube, for example, so I want to be able to hit everything here. Let's see here. Putzi saying, what do you think is the best way to get rid of minimal forehead wrinkles without Botox or fillers? If it's minimal, then you may just want to do a light laser. That's probably a great option. Something like an erbium laser is a really good option for that. A light erbium laser could work really, really well. And then if you don't want filler though, but what we want to do is trigger a collagen response, sometimes what we do is through the laser channel holes, we could place a collagen stimulating product. We could do something like Radiesse or Sculptra for that. That helps a lot there. And is saying, do you recommend tretinoin or retinol for getting rid of acne scars? Well, tretinoin is going to be superior in general because it's going to really reduce oil production a little bit better. Clef works really well. It's a novel retinoid. It works very well for that. But I wouldn't really say it's going to get rid of acne scars, but it could actually stimulate collagen production and make the scars look a little bit softer. Coco saying, thanks for the tretinoin tip. I tend to purge when I use it. Yeah, so mix it a little bit with moisturizer. It's no problem with mixing it. I don't know why everybody's worried about that. People try to think that you're supposed to just make it really dry. I don't really agree with that whole concept of making everything dry, honestly. So think about that. Let's see here. Steph is asking, how's it going, by the way, Steph? Let's see here. Stephanie's saying, Oh, just thanks again. Awesome. Jelenia saying, is it okay to get pregnant 4 months after laser treatment, or does this reduce the good improvement? No, that's going to be okay. Actually, pregnancy does probably actually could stimulate more collagen production, so that's okay. Now, sometimes you could break out a little bit with it, so we may have to want you on azelaic acid if that's the case. And it's saying, do you recommend tretinoin? Oh, I think I answered that one. Yellow saying, so excited and nervous. I'll be seeing you next Friday. Good, look forward to it, Yellow. I remember our consult really well. Yellow actually flew in from New York City just to do the consultation with me. She wanted me to see the scars in person. Really appreciate that. Normally we can do this, we can do this virtually, but I did actually appreciate the scars really, really well when she came in. We could see the depth of it. We could see it really well under angle lighting in my office. So it was really nice, actually. So I appreciate you for that, Yellow. Crystal saying, I work in Durham and we started using Elicor last year, game changer for our patients. Crystal, what are you doing Elicor for? Which kind of patients are you using it for? Is it mostly just some loose skin? What's going on with that? Drop Dead Sarah saying, was this patient's results from one session? Yeah, this is a single combination, just 1 month out. Really early results. So typically we don't usually show this on the page. Usually we like to wait about 6 months or so. He still has some redness, totally normal. Probably going to still remain red for another 3 to 4 weeks. By the way, we're going to actually showcase for everybody. We're going to be showcasing somebody's whole journey just coming up really soon. So stay tuned on the feed. We're going to show all that. And actually, we have a couple patients who've been sharing their whole journey. And it's really, really nice. They're so nice. Actually, patients a lot of times from out of state, especially, and sometimes you'll see them on here. Actually, they come on and they talk, and you'll meet them here. And they've done procedures, and it's a lot of times it's like they're showing the whole process where, like, day 1, day 2, day 3, what the scars look like, or what the skin looks like, how it's healing, and everything like that. And it's really valuable for patients. And then some of these patients have come for the second step, so we could see with exactly the same photo that the significant progress that we've made, and I really want to pride ourselves for it. Typical Vargas is saying, how much do you charge for a virtual consultation, and how is the virtual consultation? So our consultations are $100. It gets applied towards the treatment, so basically free. But the way we do this is typically you do it and take some photos. A lot of times the best way to do photos is under some sort of angle lighting. You could do really harsh overhead lighting. That works fine. Or you could go, take a photo, and if you're near the sunlight, try to angle your face. You'll start seeing those scars really well. Send those to us. I could go through the scars really well that way. I go through it really well. Sabas is saying, I would really like to have this with you. My case is similar, and I know you can help me. Please, it's very difficult to me afford. Can you help me with a discount? I would really love it. Sabas, I would love to help. Our prices are very, very competitive for the level that we do it, and I'll tell you that. Honestly, I really wanted to make sure that I could do it that way. To be honest, there's a lot of work involved. I do this at an extremely high level, but there's really not too much more room with those things. Now, that being said, going forward, though, as we do the treatments, you know that you are part of our warranty program, where essentially then what that means is that if you're following the things that the instructions that we're doing and everything else that you need to do, we're able to do future sessions like laser, TCA cross, up to 55% off. So, nobody else is going to do that. I can tell you that. And I do that because I know that just like this patient, he did one session, 1 month out, look at his scars, look at that significant improvement. I know what kind of results I could achieve with patients. And so take a look and see this, and we could do that, and so yes, there may be multiple sessions required afterwards, but I'm not trying to break you. I'm not trying to make it so that you go into a debt for this or anything like that. I want this to be very comfortable for you. I have filled up all my spots for pro bono work for this year, and most of next year too. So I think it's going to be a long, long time until I'm capable of doing more pro bono work, to be honest with you, for acne scars. But hopefully, when you're able to put it up, I could tell you most patients are about $5,000 to $7,000 for their scar treatments, and this was a single combination session for this patient. And I'll tell you, I'm going to try to maximize the results every single patient. That's what I try to do. Let's see here. So someone's saying, what should you use for acne scars? So you're on the right track in terms of doing tretinoin. Those are good options, but really, you have to do things, especially for deeper scars like this patient. You got to do more manual work, breaking up the scar tissue, doing TCA crosses, doing Bellafill. Those are things that are going to help out with there. Sebastian saying, how can I be part of that program you mentioned? You could actually apply for the pro bono on our website. But like I said, I don't have any slots available. I have a lot of patients actually that I'm going to be doing for this still. So I've been talking about it for several months now, and so I'm working my way towards doing that process. But it's going to be a while before I could fit more people in, and we'll let you know. You could put your name in there to see when we could do it again, but it may not happen, to be totally honest with you. I'll help if I could. Let's see. Gogo saying, what would you recommend to someone 21 years, healthy, the PCOS, healthy, no PCOS, overweight with cystic acne? So cystic acne really is more of an emergency situation. Think about that, or urgent situation, because we don't want scars like this. We don't want this situation over here, where the scars are so severe because you delayed treatment, because you didn't get the appropriate treatment for your cystic acne. So cystic acne, you should consider doing, first of all, you want to be on antimicrobials. So something like dapsone, clindamycin, those are all options. Or you could do oral doxycycline. But a lot of times you're going to need something like isotretinoin or the Cure Laser. The Cure Laser works really well, just like Accutane, and normalizing the oil glands. That's how it works. That's what I would recommend doing. So either that or Accutane, especially if severe cystic acne. Vincent saying, what are the best bang for your buck procedures for skin rejuvenation in your 30s? Really the best option in my case, the thing I think that's one of the better things to do for in your 30s is going to be something that's going to stimulate collagen production. One thing that you could consider doing is like an erbium laser. We create microchannels in the skin and put a dilute form of Radiesse or Sculptra. It works really, really well. You could also do you could actually do what we also do, something which is microchanneling. We could also microchannel that dilute radius through little punctures. We make these little holes in your skin with needles, and actually we also put a little bit of Botox in there. Sometimes we also put a little bit of hyaluronic acid in there to just plump up and replenish the skin. That works out really well. Dusty, I guess it's Dux D Rose is saying, recommend days in between microneedling and Retin-A. Usually you want to wait about 3 to 5 days after you've stopped Retin-A. Tofi saying, I have 3 white patches on my face, but I don't think it's vitiligo. What could you tell me? Well, if it's actually patches, still it could be, what it could sometimes be is actually due to a bit of a reaction from the sun. Sometimes sun, people know that it could cause hyperpigmentation, but it could actually cause hypopigmentation in some patients, and it's actually temporary. Sometimes that actually does happen. So just double check to see with a physician. So make sure that it's not vitiligo, but sometimes it's that. Also, it could also be an autoimmune condition. You'll have to we have to take a look and see. Let's see, Gogo's, I think I answered that. The ones there saying, user 61 saying, what do you recommend for darker skin patients wanting to get rid of boxcars? Well, you could do actually a lot of times Bellafill works very, very well for boxcar scars. You could consider doing Bellafill. You could do a little bit of Subcision there. I think that works very, very well for boxcars. Tony Santana saying, late to live, but what was the time difference between the before and after? Sorry if that got cut off. I'll try to lower it for you, but basically the time difference is just 1 month in this case, actually, because what we did was Subcision. We did Bellafill that day, which helped a ton with his temples. Bellafill is amazing in the temple area. We also did TCA cross. We also did laser, but mostly what you're seeing is that Subcision, Bellafill result, and then the skin smoothing effect of the laser. We still haven't had any collagen response really yet, so that's going to occur starting month 3 to 6. You're just going to start seeing some more softening of the scars at that point. When he came in today, I ended up doing some more Bellafill for him in his temples. You can see there's still some depression over there, so that's what I ended up doing for him, and he'll get a better result. We'll see that soon. Let's see here. I know I missed a few things. Any recommendations for mild face psoriasis? Actually, you could do, if it's mild, you could do a little bit of cream with urea in there. So you could actually do something called rough and bumpy. That's actually something to consider out there. Yellow saying, I took 10 days off for work. Is that enough? Yeah, that's more than enough. Usually 7 days is sufficient. Let's see here. Rev Edis is saying, I'm getting a couple of these after nonstop acne. How can I prevent them from getting worse? Well, actually, when you have acne, first of all, treat the acne. Usually at its source, control the oil production, control the bacteria. And you could actually do something like silicone tape. Actually, silicone tape helps with the friction and the inflammation that occurs with acne. So you can consider doing that. The nay saying no change is visible. So that's interesting. So if people think that there's no change that's visible at this point, then I will. That's why I'd like to show this. I want to have people just to see what to expect. When you're doing these treatments, this is 1 month out, so really early. That's why I didn't put it on our page, but really, this is actually to me an excellent and very visible result. If it's not that way at that case to you, then these are not treatments for you. What you have is something that hasn't been invented yet. What you want, I should say, it hasn't been invented yet. You want some scarless result that's instantaneous after 1 month, and it's you're not somebody who should be coming to someone like me. I want to be clear about that. I want to be really honest and open about that, about what to expect. This particular patient is thrilled with his results at this point. This is a very realistic, standardized photo. This is what we could achieve. This is showcasing that 1 month out. I want to show that for you guys. Yes, are her scars going to continue to improve 3, 6 months, 1 year later? Yes, it's true. But at this point, 1 month out, this is excellent. And even still, even if this was 3 months out, this would still be really excellent, actually, considering how deep his scars are. That's what I would view as excellent. That's what this patient would view as excellent. But if it's not to you, again, that's fine. That I like that. That's okay, because I want this to be super clear for people to sort of understand what to expect with this journey when they have scars. And maybe also people could have more sympathy for people who have scars then, and understand that all these things that they do and all the work that they have to put in just to improve their scars so it's less visible. This is significantly less visible. His scars in the beginning were visible from 10 to 15 feet. Now it's like 3 to 5 feet. That's really good. That's really good. Is it there yet? No. And we put a little bit more Bellafill in there to help out with his temples. It's going to continue to get better, but it's, significantly better from where it was before. Let's see here. Haley's saying, is subcision for acne scars on the chin? Yeah, you could do subcision mildly around the chin. I usually wouldn't do much of that, though. I would really probably just do localized spots in the chin. Typically, there's other better options there. Hi, saying, does a cure laser work for bacterial acne? Well, the bacteria process could still be there, so you may need to do more on topical antibiotics. That's the thing. Tears of Geisha saying, Liz, I treated my scars, Dr. Qazi. I'm beyond happy. Awesome, Tears of Geisha. I really appreciate you coming on all the time also, by the way. And, that's the thing. I love the fact there's so many people that I just love, the patients who come in, it's like, and I follow up with them 1 month out, everything. It's like, it's really amazing just to see that progress in the process of where they are. And that's why I like showcasing these kind of results. I like talking about this because I really want people to have a realistic understanding and expectation. And I'll tell you, to be totally frank and honest, I don't know, and I'm just saying this, but just flat out straight, I don't know anybody who gets consistently better results than me. If you happen to know it, feel free to say it and go to that person. I don't know anybody in the world who gets more consistent and better results than me in the world. I'll tell you, frankly, I really don't. And I'm not saying this just to say it just like that. I really do pride myself on working hard and doing everything. I get that. And I'm okay with acknowledging when I think there's a lot of other people out there that are doing very, very good job. But consistently, at this point right now, in this day, doing this over and over and over and hitting it like this, it's nice. It's nice to be able to have that. It's nice to be able to have the fact that we could achieve better skin for people who are otherwise a lot of times very depressed about their scars. And they feel like they're hopeless about this. And we finally are offering something that's going to get them there. And that's the thing, is that I would say 99% of our patients understand that process, the people that I consult with. There are a few patients, though, that do think that it should be really scarless. And you're not going to be happy. That's the thing. You're not going to be happy if you expect it to be scarless. It's not going to be scarless. And if you think that you're just done, you're not going to be done. Look at that. There's still volume loss. We still have to do more things for his volume. It takes a lot to do that. It's not something that's just going to happen one time and you're just done and you just move on with things. There's a single session combination result. If you think that there's someone else, and everybody says, well, there's things that such and such. And if you look at it, the results are never standardized photos. I hardly ever see standardized photos on anybody. I think I'm one of the only people who showcases standardized photos over and over and over and over again. it's always something like, oh, this is like a patient selfie, it's this and that. One day it's like super harsh lighting, another day it's not harsh lighting. It's like, so it's interesting, and like I do 3 cases typically a day of this, 3 a day. So it's like I do a lot of other things, but I do a ton of this. So I know that like how this process is and how this journey is, and every single time it's really rewarding because I follow up these patients and it's really, really nice, and I see them on here and it's really, really great. Let's see here. I have somebody else who was asking here for derm prescribed me clindamycin, benzoyl plus tretinoin. It's been 2 months using, it's not helping. We'll talk to your derm. I think that the benzoyl potentially could make it a little bit more drying, honestly. Let's see here. Dermal grafting, in fact, I think I missed some questions. I know I missed a bunch of questions. I'm going to try to hit a lot more questions. Sorry, I missed a few. If I missed you guys, feel free to re-ask them. Let's see here. I know, let's see here. Tony Santana saying, are fillers always necessary with subcision? How safe is subcision on the temple area? So good question, Tony. So are fillers always necessary with subcision? They're not always necessary. Sometimes just doing a subcision can pop it up. Typically, I typically don't do filler at the same day. This case, there's huge temple wasting over here. I knew it's going to be totally fine to put some filler in there, map it out. We place it in directly in there. We're okay. I put a little bit of layer in the cheek as well. That's okay. But a lot of times I want, when we're doing subcision, I want to make sure that I'm making sure that's in the right layer, that we could place that filler. So, a lot of times what I'm going to do is I'm going to wait for your swelling to go down. That's why for this patient, I put some in there, but then when he came in 1 month out, I did some more filler for him. So he needed it. There's so much volume loss. There's volume destruction in his case. So the skin is destroyed, the fat is destroyed. We have to do something for that, and that's what you can see over here. And that's our process. So it's not always necessary, but a lot of times, especially like this patient, you can see the complete fat destruction over there. It was necessary. But sometimes if it's superficial, we could just do it like that. 1112 Gene is saying, what is Bellafill? Good question. Bellafill is 80% cow collagen, 20% PMMA. And essentially what happens is that over the course of 3 months, that cow collagen starts to go down. But then by 3 to 6 months, your own body starts to make your own natural collagen around the PMMA that's still there. And the PMMA continues to stay there really continuously. It doesn't go away. It'll stay there and provide a scaffold in your skin and your scar and continue to restructure and remodel that scar. Really, really nice for scars, because even if you lose a little bit of fat, a little bit of volume, it doesn't matter. You're always going to have that there. So it's really nice. Let's see here. Miriam is saying, hi, doctor, how many days of recovery after laser for acne scars? So most of the recovery process is over the first 7 days. You can see this patient, this is totally normal. 1 month out, still has some redness. That's normal. I would expect that redness for about another 3 to 4 weeks, typically, for the vast majority of patients, especially if you're following my protocol. Now, if you're somebody who doesn't follow my protocol and then you see this type of thing and you start putting on glycolic acid, you start doing a whole bunch of other things, and then you're triggering more acne now because you overly dried your skin, your body made more oil production to compensate for that, you have bacteria, and then you jumped and now started to just go to somebody and they put you on Accutane suddenly, then you're going to delay your healing process. And that did happen to someone. That's the truth. It's like people need to follow the instructions and follow how we process this and do this so we can get you to the healing process. And we'll do that. We'll be able to help you out there. Divine Pups is saying, my virtual consultation is with you tomorrow. Awesome, Divine Pups. Look forward to it. Jack is saying, hi, doctor, a subcision option between the eyebrows. Yes, it is. I could do it between the eyebrows, and even sometimes a little bit of filler could work really, really well with that. Let's see here. Ish is saying, does PRP under eye work for hollow tear troughs? It helps improve the skin quality, but it's not really going to actually improve the hollowness over there, if that makes sense. Do you recommend halo laser for scarring? No, not really, honestly. I wouldn't really see what the halo laser is useful for when it comes to scarring, because it's holding you back, really. It's not really going to be as powerful as an erbium laser or CO2 laser, so I don't really see what the reason why is for that. Stardays is saying, is it safe for a 41-year-old woman to take 200 milligrams of spironolactone? It's the only thing that works for me. That's surprising because by studies, it really doesn't show much more effect after 100 milligrams. So it's a little bit curious. There is more risk involved at 200 milligrams. You are potentially going to cause hyperkalemia, where your potassium level could shoot up. I would really strongly recommend rechecking your blood work, really double checking, making sure that it's safe for yourself. Let's see, your smiley face is saying, hi, I have ice pick and rolling scars. What can I do for medium, darker skin? So a lot of times TCA cross works very, very well. We could do subcision. Those are all options. We may need to do laser as well, depending on what's happening. Dermal grafting is in fact great. Yes, it is. Fat grafting is great too. We could do that, and then we can use the stem cells and re-inject that into the scar. That works incredibly well as well over time, not right away. Let's see here. I know I missed a bunch of things. Let's see where I'm at with a bunch of questions here. So if I missed your questions again, if you can feel free to ask about that. This person thought this thought was about growing a beard. I know it's about scars, but I can see why he thought so. I guess he grew a beard afterwards. Recommendations for acne rosacea, probably clindamycin. That's a good option. Plus, you could do oral doxycycline. You could do a low dose of that, like 50 milligrams daily. That helps out a lot. Nicey saying, what do you recommend for under eyes aside from filler for volume loss? Well, if it is truly volume loss, then filler is probably the better option. You can also do fat. That's an option as well. My partner does it very, very well underneath the eyes, actually, really, really well. And she puts stem cells in there, which helps the skin quality as well. So that could be an idea for you. User 93 saying, what do you recommend for darkness on the neck? Well, a lot of times you have to see if you have a little bit of insulin resistance that's causing that darkness. Obesity or just being overweight could potentially cause that. So double check those issues. Now, let's say that's under control, then you could try something like Eucerin's anti-pigment cream. Works really well. Just it's slow, but it can help you out actually, and plus a lot of sunblock. Thoughts on excision for deep acne scars. So this patient actually did an excision. He did an elliptical excision. So you can see that big, so actually I wish I could point on here. At some point I got to figure it out. I'm going to do it. We did actually do excisions actually in his temple as well as the cheek area. So that's actually an elliptical excision result actually. So we're going to showcase that at some point when, actually I guess it's almost ready right now. We'll probably put it on the feed that way. And I think we have a video of us taking it out as well. So it's going to be cool. You can see the process, the elliptical excision, really, really cool. So basically, again, at some point I'll try to figure out a way to draw it out. Let me see if I could pull up a diagram maybe tomorrow too. I'll try to put up a little slideshow with a diagram of how we do elliptical excision. But basically we go in the inside walls of the scar, take it out, and then make it into a more narrow scar. Looks amazing. Look at that. A really, really great result actually with that elliptical excision over here, guys, as well as punch excision too. So did a few different excisions. So this is excision as well, by the way. Just so you know, we did a few things for this combination session. That's partly why his scar have improved significantly. These are deep, deep scars. These are deep scars. Will Accutane help with hormonal acne around the chin? Yes, it could. It really could help with that. Does Accutane help with folliculitis? It could help with that, but you may just want to do laser hair removal if that's the case, and a little bit of antibiotic. CL is saying, is fractional laser worth the money and sessions for acne scars? Not for me, it wasn't. I'll tell you that. It's not. It doesn't seem like that. Do you use exosomes in your practice, or are you waiting for FDA approval? I'm pretty conservative with a lot of these things, to be honest with you, especially with scar patients, to be totally frank. I'm not necessarily waiting for approval from the FDA, but I do want a more clarification from the FDA, because right now they've actually put a warning out regarding exosomes and stem cells. And I'm treading really carefully with that. So I'm not touching it really right now. And again, for scar patients, I get excellent results without these things. I don't want to do something that I don't know what's going to happen down the line. I really want to make sure that this is really safe. Everything we do is really safe for patients, and we don't cause more problems, with healing. So I know that people anecdotally say great things. It's unclear to me why there's not really great, robust studies about it, anything like that. It's unclear to me. And maybe there's some things that are being hidden about it. I'm not sure. I can tell you honestly. I say this sometimes right here, but a lot of the people that have been pushing exosomes, it turns out that they sell exosomes. They sell their own exosomes sometimes, or they're affiliated with a company with exosomes. It's unfortunate. So we can't really get unbiased data about this stuff a lot of times. It's like it's just unfortunate. And it's a big company, big stuff that they're pushing a lot of money towards us. And I'm unsponsored. I get no money from a single corporation, none. Everything I'm doing, I do exactly that's what I do. I buy the lasers the way anyone normally would get the lasers. I don't do anything. I don't take any cash from them, really. Sometimes they give us lunch and things like that if they want to give us a talk and educate us, our staff. But beyond that, it's like I'm not bound to any laser company, any skincare things or anything like that. So I can tell you honestly, from my own assessment right now at this point, it's a real bit of a murky spot for me, exosomes, because it's like, why isn't there more research at this point? Why is it that the FDA has this concern about it? And to be, like I said, to be frank, why is it that so many of the people who tell me to do exosomes or tell us to do exosomes have a financial incentive with exosomes? It's sort of like, why isn't there somebody who's just unbiased pushing this stuff? It's kind of interesting, right? Like it's sort of, it makes you wonder. It makes you wonder what exactly, is this something that they're just trying to push on us? Or is it something, it's sort of like I see all this beef tallow thing. Everybody's on here talking about beef tallow, and then everybody's trying to link to their Amazon affiliate store for their beef tallow stuff. It's like, first of all, beef tallow, by the way, it's not great for patients with acne. I don't know what's going on with this whole thing with it be for acne. And they're claiming it's like clearing their skin in like 3 days or something like that. It's like, let's settle down a little bit about this. But then it turns out like they're all like having like their Amazon affiliate links or like their TikTok shop stuff or something like that. And so like, how realistic are these results, and what are they really trying to tell us and all these things? So it's like, I don't know, and there's a lot of this stuff. There's a lot of this kind of stuff out there where it's like it turns out it was like this weird marketing campaign that they try to push or, get people on board. And I sort of feel that way right now with the stem cell and exosome thing, to be totally honest with you. I feel that way because I told you before, and I mentioned this before, but when I first started, I was doing things where like basically I was trusting other doctors, doctors with physicians that I knew or I met at a conference. I was excited and I was talking to them, and they were like telling me, oh, you should use this product, I can use this and use this. And then I found out that these dudes are paid by those companies and they have an incentive to get more doctors to use it. And it was like with like all sorts of stuff, it was like whether it was with threads or PDO threads or like PRFM and PRP or certain devices. There was a device that was out there that was saying that would be needleless and push into the scalp, PRP, things like that. And it's like, I talked to physicians, and it turns out they didn't disclose to me that they were basically salesmen for this thing. So it's like, how much of this can we really trust sometimes? That's what I kind of wish. It's unfortunate. Everyone's so happy with the system that we have. Everyone loves this system that they think that we're advancing stuff with this, the corporations that are out there in this capitalist system. But honestly, I think it's stagnating things. I think that we're really not going further ahead because, to do research, for example, submit things to research papers, it costs you like $2,500 to $3,000 each paper, each journal you're submitting it to. So of course people try to get funding from other people. Then you're getting funding from other people. Now you're sort of beholden to them, and you're expected to sort of present in a certain way. And there's a lot involved with this. It's sort of a murky type of world actually that we have. That we have now when it comes to research, when it comes to just advice now. And which is why, honestly, I want to be really clear. This stuff is very, very clearly unsponsored. I'm not taking money for this stuff because it's like I generate because of my work, my hands. I want to do things with how I do, like how I build. I'm building skin. I'm restructuring skin. I'm doing that myself. I don't need to nickel and dime people. I don't need to go take things from some corporation, some money, someone who's just basically trying to push some products. If I like Cetaphil, CeraVe, Vanicream because I like it. It's not like I'm paid by them. I could care less. Like, it's just like whatever. I like it. It's just a nice product to me. It's just like, it's cheap, easy. It's accessible for patients. That's why I like it. Not a single one of those companies pays me, to say that. I just like it. I'm never going to be a sponsor for them. Never. I'll never take the sponsorship. I will never take that thing. So it's like, I just want to be able to say it clearly to you guys that I like it. It's just like, they're great products. To me, it's like super simple. It's like $10, $20 instead of like $100 for stuff. It's like, why not? Of course you should. Like, of course, like what's there to lose really with that? Use Vanity Cream. And like, why am I, and like, think about it. Like people think, oh, we're trying to push products. Like, why would someone like me need to be pushing like a $20 product like this? I'm not getting anything from them. I just want you to save money instead of spending $100 or doing something like beef tallow, which is going to break you out or something like that. So it's like, that's the reason why I'm talking to you about that. That's why I want to avoid cystic acne. I want to do things that are actually going to help you. I want to have you so that you do the right treatments for this stuff so you don't waste money doing those things, because I wasted tons of money. If you actually, it's so funny. I'll just tell you this. I know I'm a little bit overboard for my time right now, but I'll tell you actually. So in my parents' house, I was there and my wife was shocked because when I was a teenager, I had so many creams. I was like, now it's like 20 years old worth of creams there. But my drawers were just full and full and full of so many different like scar gels, so many different it's just so many acne products, so many different things. I just had tons and tons of stuff over there. And that was actually after I had purged it. I actually cleaned up my drawers before I got married because I knew my wife was going to come in one day. And this was actually still literally overloaded, which is kind of comical because I thought, oh, one day I may like need it for I sometimes just put some creams on there, sometimes randomly, things like that. And it's like, my drawers were full of this stuff and it was useless. Honestly, it was useless. So it's like, I spent the money doing it. Why would I need like other people? I spent money on like St. Ives apricot scrubs or whatever, all the like apricot scrubs out there and all the other stuff. And it was terrible for my skin. Really, it was. It just frankly was. It was really bad for acne prone skin. It was pushed a lot. And like, I want to tell people don't do it. I drink this disgusting, the most disgusting herbal supplement you'll ever imagine. I don't even know what this thing was called anymore. I got to find it out because I talked about it before, but I did it for several months. I was doing it every single day when I was 16 years old. It was the nastiest thing ever. And I did it and I drank it and it didn't work at all. So I want to tell people, don't do that. When I say don't do lemon juice and mix it and put it on your face, and then don't do that, or like mix it with like an aspirin and put it in your face, because that's what was going around. We didn't really have much with like the internet in the 90s, but like word of mouth was going around. Everyone was saying, do this, do this, do this. And so I tried everything and I did it and it burned my face. I'm telling you that honestly because I did it. I did that and it burned my face. And actually it burned it really badly actually. And I still feel like my skin got really sensitive from that to this day. I think that I really am more prone to burning because of the situation that happened with lemon juice and aspirin that I put on my face one day, because someone told me that's a really good trick that's going to help out your skin. And it ended up, one time it worked okay. And then it turns out, I was like 16 years old, didn't know any better. It turns out every single lemon, the acidity is different. And it's like, oh, people are like, oh, it's natural, it's this and that. And like, they didn't tell me that like every single lemon's acidity is different, and you could actually end up burning your skin because now you use too strong of an acid on your face. So that's what ends up happening sometimes, So like when I'm saying things, it's like because like I've gone through it, chances are I've done it, and just I don't know why you would want to like make the same mistakes I've done. I did 6 laser sessions, 6 microneedling sessions. I went to, dermatologists and tried so many different creams, so many different things. I went to a plastic surgeon in Chicago to try to see if I could fix my scars, all sorts of stuff, and nobody was helping me properly. So I'm telling you exactly, and I know a lot of people's journey is the exact same way, or people are starting their journey process. I want them to know that there's other ways of doing this without going about that whole roundabout way. Because I mean, why not? Like, just if I could do something, like, that's great, and maybe I could help stop people, because it's like, it actually did upset me. It really did. It's like, I went through that whole process and I looked at it and I was like, I really am going to try to do something about this, because it's like, that's how I am. It's like, I look at something and it's like, it wasn't working for me and it wasn't great for me. And like, I want to tell people, because it's like, I don't want people to suffer, and it was suffering. Like, it was suffering, it's like, I want people to know. So hopefully, I know I miss a bunch of people. I'm going to try to finish up a thing with this about the acne vaccine. Really, really interesting. I am waiting for that as well. I'll see. I'm actually did approach them to talk to them about us being a research site. Hopefully we'll get that as well. I hope we can be a research site. How much improvement have you seen in your scars in the end? I mean, I don't know percentage wise. I would say that when you come in tomorrow, you can see me too. I'm not sure how we're doing the consultation, if it's virtual or in person. But I'm happy to show you. You can see. most patients tend to find that it's very, very mild at this point. It's like you could hardly see them unless it's under like really harsh lighting. And that's, what I feel like. I feel like day to day it's okay, but every once in a while I'm in like a dressing room and I see my scars. It's like, man, I even like had a whole talk about this that like, man, maybe dressing room lighting should just be banned, because I was in a dressing room. I went shopping one day and I was like, WTF, why are these light? Like I was like happy. I was like trying on some clothes. I was like, these are going to look really great on me. And I go walk into the dressing room and I'm looking at it, my face, and it's like, what? This is like my scars look like. Wait, what? This is what like it looks like. And like, this is me. Like, and I was like, I didn't have to remind myself. I'm like, imagine now other patients, they feel the same way after they do these treatments and stuff like that. And it's like, I feel like that sometimes. It's like, sometimes I see it. It's like, you don't see it at all. And then like you see like overhead lighting, or you're in an elevator in a hotel and like they use like the harshest lighting sometimes, and you see those scars sometimes. And it's like, oh yeah, I guess it still exists. I guess you still do have some of those things. It's like everybody has some flaws, though, really. It's like, and it's okay. But like, and I have to remind myself that. But like, it could be a little bit depressing because it's like I was like ready to try on these clothes. I'm looking at them like, is that what I look like? Is that what happened after this? Do I still have this thing? And then I was like, this is like so ridiculous though. These overhead lights. I'm just want like one day every like store needs to just say no to stop, just stop with the overhead lights. Stop with the harsh lighting. Honestly, I don't know why you're putting harsh lighting in the room. It really should be something that's just like people like maybe like you guys right now for the presidential candidates, you guys could push that. Maybe like that's part of the platform. They could have, genocide plus like this type of stuff too. And they could add that there as like something with harsh lighting. What effective treatments do you do for your scars? Well, the most effective thing was really going to be with Subcision and ablative CO2 laser. Those are probably the best option, honestly. And then plus a lot of Bellafill. I did a lot of Bellafill, really restructure that. What do you think of mandelic acid? It's light. It's okay. I like it a lot. It's actually really, really gentle. It's not too bad. Did you try CO2 laser? Yeah, I do CO2 laser once a year typically. I'm behind on my erbium laser this year, so I may end up just doing a CO2 laser. More power on you, doctor. You're a supporter from the Philippines here. Awesome, Raniel. Thank you so much for coming on there. Would nanofat be a good option for this patient? Yes. He almost has no fat though, so he really wouldn't really help too much. I know I missed a bunch of questions. Actually, I'm really overboard, but I like the interaction here, so I'm going to hit a couple more things here. Let's see here. What did I miss here? What do you think of tranexamic acid cream? Tranexamic acid, not super helpful by itself. Oral tranexamic acid may be better for like more melasma though. Let's see here. I know I missed a bunch of things here. So do silicone scar sheets actually work for scars? For raised scars, it does, but not so much for indented ones. Is microneedling helpful? Not so helpful. All right, guys. Thanks so much. I am going to be taking off right now. I do... actually, wait, let's say something. Vampire Hunter, I haven't seen him in a while. He says, you wouldn't promote products you actually use and believe in, like Bellafill. No, I would not promote that. I won't. I'm not going to promote, I actually don't take anything from Bellafill, nothing from that. So nothing. I don't take anything from any single product, even if I believe in it. I don't. I'm just in case, honestly, the thing with Bellafill too, I love Bellafill, I love Radius, I love Sculptra. So I don't want to be bound to anything. I really like it for certain things. For the appropriate patient, I'll use the appropriate injection. And I don't want to be stuck and feel that I'm bound to this obligation that I have to use something because I'm taking money from the corporation. And who knows? Maybe in the future there's going to be something better. And I don't want to be left behind because I was stuck promoting something. I'm running around. Honestly, it's I'm do well in life. I don't need to go run around these conferences and just start pushing products on people and getting a bunch of people to do this. It's just not what I need to do. I like what I do. I like just being I like being a laborer. I like it. I really do. I like doing labor. I like doing it with, like I said, I always say it. I like using my hands. I really do. I like building things with my hands. It's actually been my favorite thing in the world for me. And it gives me a lot of satisfaction just using my hands and being a worker. I like it. I don't believe in just doing work that's I mean, no offense to people who do this, but just moving money around, things like that. It's doesn't interest me. It's not exciting to me. I like things that are either building, it's teaching, things like that. You're actually properly seeing progress and growth in something, and not just your portfolio, but actually this, seeing that progress and that improvement in someone's face, in their skin. It's exciting. It's really, really nice. And like the fact that like my own hands do that is really fun to me. So yeah, that's why, like, I'm exactly that. That's me. Like, just building things with my hands and doing things with my hands is really, really a lot more valuable in life. Anyways, yo guys, I'm way over, so I'm gonna take off for tonight. I will see you all tomorrow, though. I will hopefully I'll be able to showcase a little bit more with subcision, and then I'll showcase a little bit with elliptical excision